Greetings to the panel, all the esteemed guests and the colleagues in the plenary. I'm Kwanda Mngomezulu from the University of Zululand. I will be presenting under the title From Crisis to Opportunity, a Path to Quality and Affordable Healthcare in the South African Healthcare System. So my presentation focuses on access to healthcare, because we all know that in South Africa we have an unequal healthcare system that struggles to achieve substantive equality as far as access to healthcare is concerned. So I'm going to just start with the outline of my presentation so that to give you a snapshot of my presentation. It's going to be an introduction with a background and some historical landscape on the or historical context on access to healthcare. I will reflect on some of the developments towards access to healthcare, and then there will be a theoretical framework part, the challenges in the current healthcare system, constitutionality of the NHI Act, feasibility and sustainability of the NHI scheme, strengths and opportunities. Thereafter, I tend to deal with the conclusion and recommendations. So with the introduction, it has been said that the South African healthcare system is engulfed by the challenges of inequality and affordability. Some of the people, the poor, can't access affordable quality healthcare. So there is a need for the redress in order to achieve equitable and accessible healthcare for all the citizens. So the aim of this paper is to provide a comprehensive critique of the South African healthcare insurance 2023 that was signed by the president into law and assess its feasibility in delivering affordable and quality healthcare. The paper will also look at the constitutionality of the Act and the opportunities presented by the NHI. So this is the commitment by South Africa from the 1978 Alma Mater Convention on primary healthcare, which gives South Africa a mandate to implement primary healthcare in order to improve the quality of life for all citizens. This also derives from the Sustainable Development Goals, goal number 3.8, which speaks about universal healthcare, that each and every citizen should be able to receive universal healthcare according to the need of the person. And whenever that person needs healthcare, should be able to access that particular health service. So there are some of the developments regarding healthcare as it dates back from 1919 with the introduction of the Public Health Act during the apartheid, the colonial South Africa. The Public Health Act was introduced to ameliorate the situation or to address the crisis of pandemics. People were vulnerable, were experiencing epidemics and pandemics and serious diseases without any form of assistance from the government in terms of healthcare. So there was a need to introduce the Public Health Act of 1919, 36 of 1919. But this act also failed because of poor coordination between the three tiers of healthcare system that was created by that government. This is according to Ngwena, 2003. As a result of the failure of that system of 1919, the Glucksman Commission of Inquiry was established to deal with the situation because the healthcare system was deteriorating. People were suffering on the ground. So there was a need to establish a commission of inquiry that's going to look close into the issue of healthcare to save the lives. Thereafter, the recommendations of that commission were never implemented because apartheid soon thereafter gained hegemony in 1948. The National Party took over in South Africa that exacerbated discrimination and segregation of people according to their color. So healthcare was also one of the major driving forces of apartheid, where the government excluded people from access to healthcare. But then in the new constitutional dispensation, as the ANC or the democratic government took over, they established what we call the National Health Plan of 1994, which came up with the white paper for the transformation of healthcare in 1997. So this was a major turning point in the South African healthcare system, whereby the government for the first time restructured a healthcare system that is more responsive to the needs of the people. So there was an enactment of the National Health Act 6 of 2003, which is the current legislation that deals with access to healthcare. But there are challenges with this current system, especially it's a two-tier healthcare system comprised of the public and the private sector. So these system perpetuate the disparities between the rich and the poor. The poor, they are vulnerable in the public sector, whereas the rich, they have the wherewithal or the financial muscle to pay for a private sector healthcare that is flourishing. So about 84% of the population receive healthcare at the public sector, whereas only 16% of the population receive healthcare at a private, well-resourced healthcare institution. So this two-tier healthcare system perpetuates inequality. We have seen the vulnerability of the downtrodden masses of the population battling to get proper healthcare services during COVID-19. We have seen the vulnerability of the hospital, poor infrastructure in the public healthcare institutions. So basically, there is a need for transformation in the South African healthcare system. So I will invoke two theories of that underpin this research paper. It's going to be the theory of social exclusion and the theory of social justice to show that there is an unequal treatment of citizens regarding access to healthcare, and to further advocate for inclusion of the downtrodden masses into the flourishing healthcare system. Social exclusion denotes, or it's a process whereby certain groups are disadvantaged and discriminated against, based on their ethnicity, race, religion, and sexual orientation, etc., etc. But that discrimination may be seen from public healthcare, education, and all those public institutions. So we're concerned with the healthcare sector, where discrimination is seen to be emerging. And then social justice theory, it's about the inclusion of the vulnerable in order to from the healthcare system in order to achieve substantive equality. And then there are issues around the constitutionality of the Act. There is a strong resistance from private medical aid schemes, such as the Board of Healthcare Funders and the South African Private Practitioners Forum. They are against the introduction of this or the implementation of the National Health Insurance Act because they tend to safeguard their interest because they make a lot of income out of this current healthcare system. So they are against the implementation of the NHI Act. They question the relationship between the NHI fund and the medical scheme, private health scheme, as to what should be their role when the NHI is implemented. So they need those answers, and then the government seems to be reluctant in giving them a clear answer as to what should be their role. But it has been said that they will provide extraordinary services that are not covered as part of primary healthcare. So they will be providing specialized hospital services through using those their private healthcare institutions. They also question the scope of the cover of the service, as I've already alluded, that they will be covering extraordinary or specialized hospital services. So it is my submission that the Act is constitutional in its current form. It derives its mandate from the Constitution. Section 27 of our Constitution deals with access to healthcare for everyone, and that the progressive means should be adopted by the government to make healthcare available for everyone. So this is the high time for the government. This is the initiative for the government to implement the National Health Insurance Scheme to improve the quality of life. So there are issues also around sustainability of the scheme. Our argument is that as much as South Africa is a developing country and with limited resources, but it has been seen that South Africa would spend approximately 8.9% of its annual gross domestic GDP on healthcare, yet the World Health Organization recommends that the country should spend at least 5% of its GDP on healthcare. So we can see that South Africa has that a financial muscle to fund healthcare services. And also the healthcare services can be improved through the indirect and direct taxes to build a strong base to fund the NHI through the so-called the solidarity fund. So the government will be obliged to, of course, increase taxes and payroll tax and levy on personal income tax to boost the NHI scheme so that it doesn't deteriorate. But it remains to be seen whether the NHI will be sustainable or it will level down the quality of healthcare services. But there is a doubt that it can actually lower down the standard of quality healthcare system, because it's a carefully crafted framework that deals with the early detection of diseases from primary healthcare. And then I also look at the strength and opportunity of the NHI scheme, that the Act seeks to introduce inequality in access to healthcare and improve the quality of life of the quality of healthcare services, as well as reducing the burden of diseases such as epidemics and other non-communicable diseases. The Act also seeks to strengthen the healthcare system at entry point, that is primary healthcare. So there is a potential to improve the health outcomes and life expectancy. In conclusion and recommendations, the study concludes that the introduction of the NHI scheme seeks to achieve the aspirations of the Constitution. Therefore, it should be supported across the spectrum by both the government and the private sector. They should work together towards the realization of the right to access to healthcare envisaged in Section 27 of the Constitution. But the Act also seeks to achieve the United Nations Sustainable Development Goals, as already alluded at Goal 3.8 of the World Health Organization on Sustainable Development speaks to the achievement of universal health coverage. So this NHI Act seeks to achieve that particular goal. Because South Africa also part of the global community, we are not working in silos. We have international commitments. So this is part of our international obligation as South Africa to fulfill the mandate of the World Health Organization. So it is submitted there is an urgent need for the cooperation between government and the private sector in order to successfully implement the NHI. So we have seen that there is strong resistance from the private sector that is currently offering private healthcare through medical aid schemes, that they are resisting because they feel like their client base will be taken away by the government. So they are fighting for their personal gains. So the government need to take sensitive programs to take them into confidence that they will be part of the contracting units that will be providing services to the people. So this is just a list of my references. I think that brings us to an end of my presentation. This is the list of the sources that I've included in my presentation. Thank you very much, Chair, for the time.